Once you reach your 70s, your approach to health should evolve from routine testing to personalized, meaningful care. Many medical screenings are life-saving earlier in adulthood, but after a certain point, continuing some of them can bring more risk than benefit. Overtesting can lead to false positives, unnecessary procedures, anxiety, and even treatments that don't meaningfully extend life or improve daily well-being. Instead, doctors and geriatric specialists now encourage individualized medicine, a plan based on your current health, medical history, and goals for aging well. The focus shifts from simply detecting disease to maintaining function, comfort, and independence. This doesn't mean avoiding tests altogether. It means asking smarter questions about which ones truly matter for you. Let's take a closer look at the 5 medical tests seniors should begin questioning after age 70 and explore what safer, more effective alternatives might look like for healthy aging. 1. Routine colonoscopies. When the risks outweigh the rewards. Have you ever wondered if there comes a point when medical tests do more harm than good? For many adults over 70, that question becomes especially important. And colonoscopy is one of the first screenings experts urge seniors to reconsider. There's no doubt that colon cancer screening saves lives, particularly between ages 45 and 65, when risk is higher and early detection makes a big difference. However, as you move into your 70s and beyond, the balance between risk and reward shifts. The procedure requires sedation, bowel preparation, and carries potential complications such as bleeding, infection, or intestinal tears, risks that increase with age. For healthy adults who've had 1 or 2 clear colonoscopies in the past decade, continuing to repeat the test may not add much benefit. Medical experts, including those from the U.S. Preventive Services Task Force, USPSTF, and major geriatric organizations, now emphasize individualized decision-making. Instead of automatic testing, doctors are encouraged to look at your health history, family risk factors, and overall life expectancy before recommending another procedure. What experts say: if your last 1 or 2 colonoscopies were normal and you have no new digestive symptoms, you may no longer need routine colonoscopies after 70 to 75. Instead, your doctor might suggest a FITE, fecal immunochemical test, a simple, non-invasive stool test that checks for hidden blood and can be done at home. It's safer, quicker, and still effective for ongoing monitoring. Tip: even if you stop colonoscopies, you can still protect your colon health naturally. Eat a high-fiber diet with fruits, vegetables, and whole grains. Stay hydrated and include probiotics or fermented foods like yogurt or kimchi to support digestion and regularity. As we age, the goal shifts from aggressive testing to preventive living, focusing on diet, movement, and overall vitality rather than procedures that may not change the outcome. Now that we've explored colonoscopies and when to rethink them, let's move on to another test men over 70 should reconsider, one that's often continued out of habit but not always necessity. 2. Annual PSA tests for prostate cancer. Men. Why do so many men continue getting PSA tests every year, even when the risks may outweigh the rewards? The prostate-specific antigen, PSA test, measures a protein made by the prostate gland. And while it can detect cancer early, it often identifies slow-growing tumors that would never have caused problems in a man's lifetime. The result? Many seniors face unnecessary anxiety, painful biopsies, or even surgeries that can lead to complications like incontinence or erectile dysfunction without improving longevity or quality of life. After age 70, the medical consensus shifts from routine testing to individualized care. The U.S. Preventive Services Task Force and many urologists now advise against automatic annual PSA screenings for older men, unless there are clear risk factors or troubling symptoms. That's because as men age, other health priorities, such as heart health, mobility, and mental wellness, often become more relevant to long-term well-being than detecting a slow, non-threatening prostate cancer. What experts say: if you've had normal PSA levels for years and no urinary problems, further routine PSA screening may not be necessary. However, if you notice new symptoms such as frequent nighttime urination, weak urine flow, or pelvic discomfort, it's wise to discuss these with your doctor. In these cases, a targeted evaluation makes more sense than a broad, repeated test. Medical experts stress that men over 70 benefit more from shared decision-making. A collaborative conversation with your doctor that considers your personal health history, life expectancy, and comfort level. Tip: you can naturally support prostate health by staying physically active, keeping hydrated, and limiting processed red meats and high-fat dairy products. Adding foods rich in lycopene, like tomatoes, and zinc, like pumpkin seeds, may also help maintain prostate function. In your 70s and beyond, medical care should feel empowering, not overwhelming. The goal isn't to test endlessly, but to make smart, meaningful choices that enhance your quality of life. We've covered the PSA test, and when to question it, let's turn our attention to another screening that many women continue out of habit. 3. Routine mammograms. Women. Did you know that after age 70, mammograms are more likely to find slow-growing or harmless tumors than life-threatening ones? While breast cancer screening remains a powerful tool for early detection earlier in life, the balance of benefits and risks begins to shift as women age. The test can sometimes detect tiny, non-aggressive cancers that might never grow, spread, or affect overall health, a phenomenon known as overdiagnosis. This can lead to unnecessary anxiety, biopsies, or even surgeries that may not improve longevity or quality of life. That doesn't mean mammograms lose all value after 70, but rather that they should be approached with personalized care, not automatic repetition. The key question becomes, will this test meaningfully improve my health at this stage of life? What experts say: if you're a healthy, active woman who expects to live another 10 years or more, continuing mammograms may still make sense. But if you have chronic conditions, limited mobility, or other serious illnesses, it's worth discussing with your doctor whether the test is still necessary. Many geriatric specialists now recommend individualized screening schedules based on health status, personal risk factors, and family history. Modern guidelines focus on shared decision-making, you and your doctor working together to weigh benefits, risks, and preferences. For some women, reducing the frequency of mammograms or stopping entirely may offer greater peace of mind without compromising safety. Tip: even if you stop regular mammograms, continue to perform monthly self-checks. Look for any new lumps, nipple changes, or skin irregularities. Early detection through body awareness remains your first and best line of defense. Taking charge of your health after 70 means focusing on the tests and habits that truly serve you, not those that add worry without benefit. The goal is confident, informed decisions that prioritize your comfort, dignity, and well-being. Now that we've covered mammograms and how to personalize your screening approach, let's explore another growing trend in senior healthcare, one that promises early detection, but often brings unnecessary exposure and anxiety. 4. Full body scans and preventive CTs. How many times have you seen an ad or article promising that a full body scan can detect diseases early and save your life? It sounds reassuring, but for most healthy adults over 70, these scans can do more harm than good. While technology has advanced, more imaging doesn't always mean better care. In fact, full-body scans often pick up small, harmless irregularities that lead to false alarms, unnecessary biopsies, or even risky follow-up procedures. Every CT scan also exposes your body to a dose of radiation, which can accumulate over time and slightly increase cancer risk, especially when done frequently or without clear medical need. For seniors who already undergo routine medical care, adding extra just-in-case scans rarely improves outcomes. Instead, they can create anxiety and confusion, especially when results are unclear or require more testing to rule out something minor. What experts say: leading organizations such as the American College of Radiology and Choosing Wisely campaign strongly discourage full-body or preventive scans for people without symptoms or specific medical concerns. Instead, they recommend targeted imaging, meaning tests that focus on a particular area of concern, like a lung scan for smokers or an abdominal scan for known digestive issues. This approach gives clearer, safer, and more useful results. Tip: maintain regular physical exams and have open, ongoing communication with your doctor. Share any new or unusual symptoms early, such as unexplained pain, shortness of breath, or fatigue, so your provider can decide whether imaging is truly necessary. Often, simple blood work or a focused ultrasound provides the same insight without the risks of full-body exposure. Remember, the goal isn't to search for problems that may never exist. It's to manage the health you have right now with wisdom and precision. Fewer unnecessary scans mean less radiation, less stress, and more time focusing on habits that truly support longevity, such as nutrition, movement, and emotional well-being. We've uncovered the truth about full-body scans. Let's move to another common area of over-testing among seniors, one that's important but often done more often than needed. 5. Bone density tests. Too frequently. You know how important it is to keep your bones strong after 70. But here's the truth. Getting a bone density test every year may not be helping you as much as you think. The DEXA scan, which measures bone strength and screens for osteoporosis, is a valuable tool when used correctly. However, after a certain age, doing it too often can lead to unnecessary worry, false alarms, and extra costs without changing your treatment plan. Osteoporosis develops gradually, not overnight. In most cases, bones don't weaken enough year to year to make a noticeable difference on the scan. That's why experts now recommend spacing these tests out, focusing on long-term trends rather than small, natural fluctuations. What experts say: according to the National Osteoporosis Foundation and geriatric specialists, most seniors only need a DEXA scan every 2 to 3 years, unless you're taking bone-strengthening medication, recently suffered a fracture, or have significant risk factors like steroid use or early menopause. For many older adults, repeating the test too soon only adds unnecessary radiation exposure and anxiety over minor score changes that don't require treatment adjustments. Instead of relying solely on scans, doctors emphasize building bone strength naturally through daily lifestyle habits. Regular strength training, resistance exercises, or even brisk walking stimulates bone growth. Pair that with calcium-rich foods, adequate vitamin D, and maintaining good posture and balance to reduce the risk of falls. These small, consistent actions do far more for your bone health than any frequent test ever could. Tip: talk openly with your doctor about your personal risk factors, current medications, and recent bone health results. Together, you can create a realistic schedule that protects your bones without unnecessary testing or stress. Remember, after 70, smarter healthcare means doing what's truly useful, not just what's routine. Over-testing can sometimes distract from the daily habits that truly matter for strength, stability, and vitality. You've learned which medical tests may be worth rethinking. Let's bring everything together with a simple, personalized plan for better long-term health. Creating a smarter testing plan. After 70. By the time you reach your 70s, your body and your healthcare priorities have changed. It's no longer about doing every test available. It's about doing the right ones for your specific health needs. The smartest approach is to sit down with your doctor and review your full screening history. Look at which tests you've already had, what the results showed, and whether repeating them would truly change your care plan. Before agreeing to a new procedure or screening, ask, how will this test affect my treatment or quality of life? If the answer isn't clear, it may not be necessary. Whenever possible, request lower-risk alternatives. For example, a simple stool test instead of another colonoscopy, or a focused scan rather than a full-body CT. Your time, comfort, and peace of mind matter just as much as your test results. The goal after 70 isn't more testing, it's more meaningful care that supports longevity, independence, and quality of life. But have you ever wondered what unnecessary testing really costs, not just in money, but in stress and well-being? Let's explore that next, the real cost of overtesting. Many people believe that more testing means better care, but after 70, that's not always true. Unnecessary tests can actually do more harm than good. They often lead to false positives, results that suggest something's wrong when it isn't, causing unnecessary anxiety and worry. Those false alarms can then lead to painful or risky follow-up procedures, including biopsies, scans, or treatments that offer little benefit and sometimes cause new complications. There's also the financial and emotional toll. Extra testing means higher medical bills, more doctor visits, and increased stress, often without improving health outcomes or longevity. What matters most at this stage of life is quality, not quantity, of care. Being proactive about your health doesn't mean saying no to medicine. It means saying yes to smart, individualized decisions that fit your needs, comfort, and goals for aging well. Remember, staying informed and asking questions isn't refusing care. It's choosing the right care for your stage of life. Now let's take a look at how to begin improving your health safely and effectively. Getting started safely. Taking charge of your health after 70 means making informed, confident decisions. Not avoiding care, but choosing wisely. If you're thinking about stopping or skipping certain tests, always discuss it with your doctor first. They can help you weigh the pros and cons based on your medical history, current medications, and overall goals for aging well. It's also helpful to bring a trusted family member or friend to your appointments. A second set of ears ensures you don't miss important details and gives you emotional support when making complex decisions. Keep an updated record of your tests, screenings, and results, whether in a notebook or on your phone. This helps avoid duplicate procedures and ensures every doctor you see has a clear picture of your health journey. Remember, being proactive doesn't just mean getting tests. It means asking questions, staying informed, and understanding what truly benefits you. Empowered patients live longer, healthier, and happier lives, not just through treatment, but through smart, personalized care choices. After 70, the goal of good health isn't about chasing every possible test. It's about protecting what truly matters: your energy, clarity, and quality of life. Smart medicine means knowing when to say yes and when to pause, focusing on tests that make a real difference rather than those that only add worry. By asking thoughtful questions and discussing your options, you take charge of your well-being, transforming healthcare from something done to you into something done for you. Remember, good healthcare is about wisdom, not worry. It's about working with your doctor, not just following outdated routines, and recognizing that prevention also means avoiding unnecessary risks. Recap. 5 medical tests to question. After 70 routine colonoscopies, consider simple stool tests instead. PSA tests, men, only when symptoms appear. Mammograms, women, based on health status, not habit. Full body CT scans, avoid unless driven by clear symptoms. Frequent bone scans, every 2 to 3 years is usually enough. Ask questions, stay informed, protect your peace as much as your physical health. If this helped, share it with a loved one over 70 who's ready to take control of their health journey. And comment below, which test on this list surprised you most? Stay tuned for more senior wellness tips to help you stay informed, empowered, and thriving, one smart choice at a time.